This conference will now be recorded.
All right, folks. So I'm sharing with you this image of that I had gotten off of the internet there, and I'm sharing it with you all. It was on Google Images, and it's produced by virtualmedicalcenter.com. And you'll see here, I like this image because it really, in one page, you're seeing a good portion of what's taking place and happening as far as the immune response is concerned. You're seeing your non-specific immune response, and the innate, and the acquired, your specific immune response. You're seeing here as far as that we have levels of the immune system as far as you'll see in the PowerPoint in just a moment there, as far as your physical barriers. Then we have what's taking place within the blood, and in particular then the specific immune response as far as the T lymphocytes and the B lymphocytes. And as far as the antibodies are concerned, and the specific types of specialized cells, T cells that are present in order to mount a more specific immune response. And really understand also that you'll see here, you're not seeing the memory cell listed here, but there are memory B cells and memory T cells that are involved in your specific immune response that can allow for you to have immunity for many years, not just a few days, right? So this will allow for an activated specific immune response day 2 to day 102, the day past that, right? So there are issues where you could need to have a booster, right? So we'll be talking about tonight a bit there as far as vaccines. And after you've had a vaccine for a period of time, cells might die off, and so there might not be as strong an immune response of your body specifically to some type of antigen. So we would give you a booster shot in order to improve that ability to mount a specific immune response. But great image here. And so we're going to start off tonight there looking at the physical barriers and such. And so like we would say like your first line of defense, then your second line of defense. These are all, again, the non-specific immune response. And then your third line of defense as far as the immune system is concerned with your T and B lymphocytes. So let's go into the PowerPoint and take a look, and we can come back to that image. So you'll see here, this is, I like this image here. Let me All right, so this is a great image, and just showing you as far as those lines of defense. As far as the first line of defense would be these barriers, as far as the skin, the mucous membranes, the secretions of the skin and mucous membranes, and realizing that this is really the first line where your body has some type of interaction with the world around you, right? So your skin that has not been disrupted, there's no cuts present, can allow for a very good defense. The skin also has a bit of a acidity to it, so that can also, they call it the acid mantle, and that also leads to a very good barrier to pathogenic type bacteria. So realize that we have bacteria covering our whole body, all throughout on the external portion of our body. And it's that covering of that symbiotic relationship with the good bacteria that will help with our ability to fight against any type of pathogenic bacteria. You'll have to excuse me one moment. I'm going to press mute. Okay, so that first line of defense there, we're looking at that as far as, and also the skin with the integument and the mucous membrane. So realizing that, you know, whether it's the oral cavity, the nasal cavity, we also have the eyes, ears, right? All of these areas where there's an opening to the external environment, there needs to be defense measures present there. There can be secretions and different mechanisms that the body can use in order to really be that first line of defense. How about your tonsils and such, right, in the oral cavity? That ability for those tonsils to form a ring around the pharynx in order to aid in the ability to look for pathogenic microorganisms and mount a defense against that. Okay, you'll see here as far as the second line of defense, and what it showed on that image there before was that present within the blood and such. So phagocytic leukocytes, antimicrobial proteins, inflammatory response, and fever. So I would like to, there we go, is take a moment and look at as far as these proteins are concerned, okay? And we're going to look at, well, actually, let's look at this image here, and then we'll go to a couple of images that I've posted for you all. Here we go. So complement. These proteins are very important as far as in their ability to work within the non-specific portion of the immune defense. So if you use the mnemonic here, oil, right, representing opsonization, inflammation, and lysis. So lysis, we realize that it's a matter of a cell destruction, okay? Inflammation, we kind of get that, and I'll show you a couple of images that I've posted for you all that'll be very helpful when you're thinking of inflammation. Right away, when you think inflammation, you think of swelling, you think of redness, right? Pain, we'll look at that in just a moment. And then opsonization, this is marking of a pathogenic cell for destruction. Very important, folks, that complement does this, as well as your antigen presenting cells, like a macrophage, like a dendritic cell. These are very important to, they'll phagocytize a foreign cell. They'll put the pieces of it out on their plasma membranes, and that will also activate the immune response and mark these cells then specifically for destruction. So in addition to the complement, we have also the antibodies. Antibodies will mark pathogenic cells for destruction. So let's move out of this for a moment. And let's go to an image, two images here that I'll show you. Let's see here. First, I'll show you my images on inflammation that I posted. So this is a really nice image. And it's just showing you that with inflammation, if someone were to say the 4 cardinal signs, you would think these first 4 right here. And then if they were to say the 5, you would add, in addition to the 4, you would add this fifth one, which would be loss of function. So you're all familiar with this, pain. Now, redness, because if something is inflamed, it looks red. Well, also as a result of that redness, then because there's vasodilation and blood is coming to the surface, it's going to feel hot, right? So heat, and then swelling, because not only is there going to be more blood flow to the area, but there's going to be liquids that are going to be involved in helping to allow for cells to move, that will be able to fight any type of infection, and so swelling edema is present. And then as a result of all of these, there can be a loss of function. So it's a really nice image. I like that image there, and so I'm sharing that with you all. And I'm going to see the other one. Let's see. Oh, here it is. Here we go. And here's the other Word document, but it gives us all of that information there, and just as far as in a chart form. The redness, the heat, the swelling, the pain, the loss of function as a result of all of this that's going on. All right. So very important to have an idea and understanding of, what's taking place with inflammation. So we have vasodilation, we have dilation of the arterioles and vessels. So then also what's going on is that the blood vessels are leaky. So they're leaking fluid, in particular plasma, into the area, which contributes to what? Accumulation of blood and damaged tissue cells, and also this fluid, which contributes to the edema, the swelling. The heat as a result of the increased blood flow, and the pain as a result of not only just direct injury to the nerve fibers, but also the pressure of that increase in blood supply, and also irritation of the nerve endings. And then these chemicals also present, which are all bradykinins, histamine, prostaglandins, all contribute to an increase the inflammatory response, which should help short term. It's when we have a long-term issues with inflammation and different types of processes, autoimmune processes that will contribute to increased sustained inflammation over long periods of time, not a good thing. So chronic inflammation, not good. Short-term inflammation, very helpful as far as our immune response, but chronic inflammation can be very detrimental to all aspects of the body, the cardiovascular system, the musculoskeletal system. Yeah, chronic inflammation is never a positive thing. Okay, let's go back to our, I wanted to show you the complement. Yeah, let's look at that. We have 2 images for that I've posted for you all. First, we'll look at, this is not an image, but just giving you, okay. So the functions of complement here. So I said to you that this opsonization, this promotion of phagocytosis, this form of endocytosis, where we're marking pathogenic microbes and cells for destruction by macrophages. So macrophages, monocytes, neutrophils, right? These are all involved in phagocytosis, okay? Inflammation, we talked about inflammation, and then lysis, we talked about that as far as destruction of these cells. So not only can they mark the pathogenic cells for destruction, but they can also destroy them themselves. And I'll show you how that what's called this complement cascade, these different proteins, approximately 20 proteins coming together in order to work to destroy a cell. It's pretty wild. So let's go to the next one. Here we go. So this would be this image here. So again, I've shared all these images with you all. Yeah. Okay. So what you're seeing here is this. Here's the microbe, and here we have the first protein, complementary protein, within this cascade of multiple proteins. And you see there's numbers on them, right? Approximately 20. That when they become active, and you see right here also, that they can come together and actually form a hole in the plasma membrane of a pathogenic microorganism and lead to the contents of the cell to come out of that hole and lead to its destruction. Okay, so it's pretty cool. So pretty amazing how these proteins can work together in fashion in order to form this, it's like I said, this cascade of multiple proteins coming together, all working, complementary proteins working together in order to then lead to tissue, to the cells in activation, as well as its marking for destruction and actually destroying it eventually also. I have to tell you, it's something funny. I'm sitting here in my home and I can hear the ice cream truck outside playing Christmas tunes. Kind of surreal. All right, so here we go with non-specific immune defense. So this non-specific immune defense, really it's non-specific as it's saying right there, and it's really like the first and second line of defenses that your body has. Again, all of them, all of these first and second and third, they all work together, but you know there are different roles and jobs, absolutely, and functions. So this non-specific, right, not dependent upon prior antigen exposure. So if we come in contact with an antigen, right, this protein that could quite possibly make us sick, and we've had an exposure to it in the past, the third line of defense, the B lymphocytes, the T lymphocytes, there's a memory that they know and can recall that encounter with this specific antigen, and will mount a quicker action as far as immune response to whatever that may be. Non-specific, it does mount a quick response, but it's non-specific, and again, too, it's just different than, and I would say maybe not as powerful as the third line of defense. Okay, so skin and normal flora, the mucous membranes. Know that also, like for your saliva and for your tears, there are also specific types of chemicals present, as well as lysosomes, as well as specific types of immunoglobulins, which would be antibodies, IgA in particular, that are present also to be the part of that first line of defense. Okay. Sneezing, coughing, tearing, right? These are all reflexes that can also help to wash away and remove any type of something that is causing some type of response, right? Elimination, meaning it's exiting out of your body, and the acidic environment. So as far as your acidic environment would be, think of, I said, the acid mantle of your skin, which is a slight acidity to it, as well as your stomach is very acidic and has hydrochloric acid present, extremely acidic, and this environment is not conducive to most microorganisms. Now, there are still some that are present. We'll talk about that as far as with peptic ulcers and such. We'll discuss that. H. pylori in particular, Helicobacter pylori. primarily bacteria do not like an acidic environment. And then inflammation that we discussed earlier. The lymphocytes are very powerful precursors of many cells involved in the immune response. You'll see here as far as B cells can differentiate and become plasma cells, as well as memory B cells. These plasma cells are your antibody factories. They produce antibodies and kick them out and are able to really work to inactivate and mark pathogens for destruction. That's an antibody. The T cells, so we have the B lymphocytes and the T lymphocytes. T lymphocytes can become helper T lymphocytes, killer T lymphocytes, suppressor, or has an inhibitory effect upon the immune function, and both of them produce memory cells, and then macrophages, which are monocytes that differentiate and become these macrophages where they can be stationary or traveling, okay, and involved in phagocytosis, a form of endocytosis, cell eating, quote unquote. Right? So the ability of the body to resist infection from pathogens, damage from foreign substances, chemicals, viruses, right? This is all a part of our specific immune response, okay, to specific antigens, specific proteins that are foreign to our body that could make us sick, okay? Now, we'll use the term, and this is just in as far as we have in anatomy. Let me go back. Sorry, one moment there. I want to, we're missing, if I got to bring this up a little bit. There we go. There we can see it now. Good. Bring this down. Good. So in the humoral, so yeah, so let me come back for a moment here. Let me, and show you this. Okay. So you'll see here as far as there are cytotoxic T cells and there are natural killer cells. So the natural killer cells are more a part of the innate and non-specific immune function, and then cytotoxic T cells are more a part of the specific immune response. But know that the cytotoxic T cells and the natural killer cells, they both are one of the specific types of cells, in addition to macrophages and neutrophils, that are actually specifically going after a pathogenic microorganism and destroying it, okay? So natural killer cells, think the non-specific. Cytotoxic T cells, think the specific immune response, okay? Good question, thank you. Yeah, you're welcome, Sean. Okay, so let's come back here. So it's good for you to, I would absolutely tell you to print out those images that I gave to you, that I just posted today, and in particular, you know, have them when you're doing your studies and such, and have the two slides. So, you know, I didn't show you the second slide. Let me do that. I don't think I did. I want to show you. I want to show you the other image. No, that's common. It'll take me a moment. I want to show it to you because it would be very important also for you to see that. Here we go. Yeah, this is a nice one also, that this is a good image. Cells of the immune system. I've posted this for you all, and you're just another image just to see these different types of cells that are involved. So you see there the dendritic cell and the macrophage involved in antigen presentation, or we call them antigen presenting cells. And really the dendritic cell is the primary antigen presenting cell. It takes the antigen, engulfs it, takes pieces of it on its plasma membrane, the plasma membrane of this cell, of the macrophage, right? And then it will go to, and it will present itself to specific cells of the immune system that will in turn, so these helper T cells will then check out what the antigens are being presented on the plasma membrane of this antigen presenting cell and mount a specific immune response as a result of that presentation. So really it's activating the immune system. Understood? And in particular, this helper T cell has a very important role in that. Now, know that HIV that will attack, the virus will attack the helper T cells and hijack those helper T cells and really create more viral viruses, right? That'll spread throughout. Really, when you think about a virus, I have to tell you, you're thinking about this this particle that's a pathogenic particle. It can make you sick, right? We get that, but they're tiny. So a bacteria is small, and a bacteria. Think about a bacteria about the size of a mitochondria present within a cell. Okay, eukaryotic cell, mitochondria. Think about that size for a bacterium. Then think that a virus can actually infect a bacterium. So think about how tiny they are. Right. So and really they need to hijack other cells in order to reproduce because they don't have their own organelles, the virus. Okay. Okay. So let's go back to the PowerPoint here and look at. Okay. All right. So we're looking at here. We're seeing here. We call this the humoral immunity, meaning that really when the body was first when it was discussed that there were humors. We're talking ancient history here, right? That's why the term humoral comes up as far as the fluids of the body. Okay, so the B lymphocytes will become, right? They mature in the bone marrow. See the B, the bone marrow, B lymphocytes. So they mature in the bone marrow. The T lymphocytes mature in the thymus gland. T, thymus, right? So the T lymphocytes mature in the thymus gland. So the B lymphocytes, they'll differentiate and become those plasma cells, which will in turn produce the antibodies. As you see here, the plasma cells. And again, we'll look at that image of the specific cells of the immune system. Again, you got to look at these things and reinforce it with you, right? The continual review of information is vital and important for you all, please. So as far as then cellular immunity, so humoral immunity, we think of the B lymphocytes. Cellular immunity, we think of the T lymphocytes, okay? And so these T lymphocytes, I showed you before there, as far as having those cytotoxic T cells, as far as the helper T cells, as far as the suppressor T cells, and then both B and T lymphocytes have the memory lymphocytes, memory T and memory B cells, okay? And again, I mentioned to you about the thymus gland. So immunity, the ability to recognize foreign agents. So, excuse me, these antigen would be a protein, right? This antigen is a protein, and this antigen is what antibodies will protect up against, and they will recognize. So your immune system has the ability to recognize self and non-self. When there's an issue where your body cannot recognize non-self, that's an issue where then the body's immune system starts attacking itself, and we know that that's an autoimmune type process taking place in your body. And we've looked already at, and we're going to see at the end of the slide presentation, you'll see I have a listing for you all. Actually, we can go to it right now. Yeah, so look at these. I have 2 slides just full of, so we've talked about Hashimoto's, we've mentioned Addison's, we've mentioned Graves' disease, multiple sclerosis, and Guillain-Barré. I mentioned in brief passing myasthenia gravis. We mentioned about pernicious anemia, rheumatoid arthritis and psoriasis, diabetes type 1. So you see that these are multiple autoimmune type diseases where the body's immune system is attacking specific areas, and sometimes in some instances can be really throughout the whole body, attacking multiple systems. So these autoimmune disorders can be devastating. Okay, so the antigen, that's foreign protein, like I said, it's a protein in our body, and again, it's foreign because it's a non-self. So what can happen is that, as a result, B lymphocytes differentiate into plasma cells, which will in turn produce specific antibodies, which will in turn inactivate they'll allow for these cells that are foreign to clump together, and they'll also, because they're present, they'll allow for then the other cells that are macrophages and that have phagocytic ability to be able to see them and attack them, right? So neutrophils in particular, right? Phagocytic white blood cells eat the antigen. Someone had a question. Let me see. Stop sharing for a moment. Oh, okay. So that was share back again. Okay. So now we're going to look a little bit as far as these antibodies are concerned. So know that immunoglobulins are part of are one type of, if you remember, plasma proteins, right? In particular, albumin is the #1 plasma protein, but there's other plasma proteins, and immunoglobulins are another type of plasma proteins. Now they have specific shapes and such, and so you'll see here, this is a generalized shape of an antibody. Of an antibody. And we're going to see now, this I need you to know. I need you to know that the different types and what's specific about them. So I've highlighted, all right, I've made it in bold and underline as far as for each one of these, what's going on. And know that IgM, they're the largest and they're the first released as far as antibodies are concerned. Then IgG would be released, and they are really the ones that are produced in greatest numbers. So attacking bacteria, viruses, toxins, right? Activation of complement, cascade, IgG. So IgM, first one out the gate, the largest one as far as antibody size, and then IgG would be the next one that's released. Now, I said to you all, present in tears, saliva, sweat would be the IgAs. IgE, we would have as far as allergic reactions are concerned, parasites, IgE. Right there. You know, you should make a note of that. Okay. And then IgD, found on the surface of B lymphocytes, and there's not a whole lot as much known about the role of IgDs present. Again, this is immunoglobulin G, immunoglobulin A. That's what that represents. These are specific types of antibodies. Now, the term active and passive, for those of you that are taking the medical terminology course, this is not new to you, right? And what I'm going to do right now is just show you this image right here, which I've shared with my medical terminology class in talking about immunity in our discussion boards. And you'll see here as far as, so this, folks, is how we think when you think about your immune response. This is how I would recommend to you thinking about active and passive, okay? And whether we are exposed to a pathogen naturally or artificially, as far as our immune response and as far as our exposure to. Okay, so look at this for a moment here. So active immunity means that your body will actively form an immune response to something. Actively form an immune response to something. So in the case of natural and active immunity natural, it's that you actually come in contact with. So I was sick, so I actually, thank God I tested negative for COVID. So that was good. I just got that result today. But you know, I was exposed to something, some type of cold virus or something, right? Some type of virus. So I was naturally exposed to it, whether I was out in public or in my family. I don't know. It's hard to know. But my body then ended up mounting an immune response to that reaction, to that infection. So that was a active, natural immune response. Now, artificial, so active artificial immune response would be if, and when I was in the service, I recall having been given many shots in boot camp. Every Friday they would line us up, and this was when they had these really painful type guns that they would do it, and you'd stand there and they'd do one in one arm and one in the other, and then they'd make us go out and do push-ups afterwards, which was a lot of fun. Yikes. But that was something. But artificial immunity, this active artificial immunity, is that you are artificially been given a dead or a weakened antigen that your body now then can respond to somehow as far as mount an immune response. And it would be actively mounting an immune response to this antigen that you've been given artificially. Now, passive immunity. So passive immunity, we see here with the baby that's breastfeeding. So mom is passing on her antibodies to her baby via the breast milk. Also, when the baby, for the preborn baby, um, prior to being born, the baby is receiving immunity antibodies via the placenta naturally from mom. Okay, so this is, did the baby do anything for this other than just breastfeeding? The baby is receiving passively these immune cells, these antibodies and such, right? From the breast milk, from the placenta. Artificially, how could this be important? Well, this is important, folks, because as far as passive artificial, the person that's receiving this blood product, they are receiving already formed antibodies to something. So say in the case of rabies, right? They need to attack that right away if they suspect someone has been bitten or they have definitely been bitten by a bat or by some type of rabid animal. They need to, person can die as a result of rabies. So we need to right away give them these already formed antibodies. We can't wait for the body to take days to form these antibodies. So we give them a blood product that already has preformed antibodies. Or say some type of antivenom and such also. This would be an artificial, passive artificial type of immune response. Your body is not doing anything other than just, now I would tell you this is interesting. So in my own family, we had sadly a possible exposure of 3 of my children. And so we took them right away to the hospital, to the emergency room, and they ended up receiving a rabies vaccine as well as the antibodies that were already preformed, so that in case there was this possibility that they were bitten by this rabid bat, which we didn't know was rabid until days later, we had gotten the test results back. But we preemptively did that so that we could make sure that there was no issue that very bad. So these artificially produced antibodies right away are attacking if there's anything present that the rabies virus is present in any of the cells that they've been infected. All right, so this is a great image and very helpful in understanding active, passive, natural, artificial. Okay, you need to know this, very important. And here's just another way. So here's another way of just putting it so that you can see here natural, artificial. And then it's not a picture. I like the picture one better, but this also gives you, as far as on the natural side of thing, right? Antibodies passing passively from mom to the fetus, to the preborn baby via the placenta or via breast milk as the baby's born. And then also here actively, as far as you have been exposed to this microorganism, this pathogen naturally. Then artificially, like I said, as far as vaccination or as far as these preformed antibodies, right? An immune serum. So this is a blood product. So there is a risk. There's always a, understand this, that there's always a risk. There's a risk with anything that we take into our bodies. Know that. There's nothing is just without risk. But again, too, had with my children there, having been exposed to this possible rabid bat, which we found out was rabid, right? Having those preformed antibodies given to them right away can save a life. And so there's no even question about that. It's just, I would do whatever I could for my family, my children. Scary stuff. All right, so you can review this and look at this and see this here and see that as far as natural immunity, immunity you're born with, inherited, permanent, acquired. There's the natural and the artificial we talked about. And then this passive, as far as we talked about the passive and active. Now we come here. Cells of the immune response and other defenses. So again, these B lymphocytes, very important as far as becoming these plasma cells, which will then help to produce antibodies. The helper T cells, or they can also be known as the CD4 cells. And I'm sorry that I'm not remembering off the top of my head what CD4 represents, but they're just these are helper T cells. These are the T cells that will enable the specific immune response. because they really do help to activate, stimulate the production of those cytotoxic T cells, which have a just analogous to these natural killer cells. They will actively go after and destroy a pathogenic cell. Understand that, okay? So cytotoxic T cells, natural killer cells, they will actually go after something like a macrophage and attack it and destroy a foreign cell, okay? But the helper T cells really help to really enable the specific immune response. Think about that. They're helping, they're enabling the specific immune response. The cytotoxic T cells, these are actively, like I said, involved in destruction. They attack virus-invaded body cells, attack cancer cells, which are mutated body cells, our own body cells, right? And also these virus cells, these are attack virus-invaded body cells, right? Because again, too, the virus needs to, in order to propagate, it needs to hijack a cell and use its organelles and such to produce more viruses. Right? And this also, cytotoxic T cells can reject body grafts. So really, you know, it's important to take that anti-rejection medication in order to prevent, again, part of that immune response would be these cytotoxic T cells. The memory cells present for both T and B cells, a memory of a specific interaction with a specific microorganism. And then I said to you that the suppressor T cells. So why would we need this? So again, know that a strong immune response short term, a good thing. A strong immune response long term really requires a lot of the body as far as energy wise, and also it can lead to an autoimmune process, an autoimmune result of the body immune system so intense that it's attacking body cells, healthy body cells, not only just the damaged and infected cells. And the macrophages we've talked about, all right, as far as engulfing and digesting antigens, and then again being an antigen presenting cell. So let me just write that down just so that you're seeing that term. You need to know this term. APC. So we have the dendritic cells and macrophages. Okay, good. Right. So chemicals in the immune response, right? So there are chemicals that are being released, and these are also going to be a part of enhancing inflammation, enhancing the action of these cells to do their jobs, truly, okay? So very important as far as their role in the whole immune response. And you'll see here, as far as cells of the immune system are releasing these specific types of chemicals and such, which will lead to. And so I want you to focus here as far as two things here in particular. So the skin, that physical barrier, that mechanical physical barrier, has the acid mantle. And so sebum, oil produced by sebaceous glands, it's antibacterial. And also, like I said, the skin has this as a result of chemicals present on the skin, and the oil present has a little bit of an acidic pH to it. I mentioned to you that IgA present within tears and saliva, as well as lysozyme. I mentioned that term earlier today, right? And they're antibacterial. Mucous membranes, right? They're sticky, so they can help to trap microorganisms and debris and prevent it from entering into digestive system, prevent it from entering into respiratory system deeper, right? And so really the action of cilia can help to move material trapped in the mucus either out of your body so that you actually, you know, release the mucus with, if you're producing excess mucus as a result of some type of infection, right? It can trap the microorganism, then you spit it out, or you actually swallow it into your digestive system, and the actual stomach's acidity will destroy them. Immunization, right? There are charts for different ages and types of vaccines that are present, right? Again, process of increasing an individual's resistance to an infection by artificial means. So again, remember that's artificial active immunity. So you're actively forming an immune response to the immunization, which is artificial that you've been given. Autoimmune disorder, so when the body takes the target cells that are healthy body cells, self, we would say. When we think of immunity, we think of self and non-self, okay? So non-self would be something that the body should mount an immune response to. Self, the body tissues and the cells itself, no, it should not. So we have an autoimmune disorder when we're doing this. Can be multiple causes, can be genetic, so it's really hard to say. Other factors can be present that can also elicit and contribute to the etiology of. And these are what I had showed you earlier there today as far as these different types. So you should review this for this chapter, please, these autoimmune disorders. Okay, I've provided this for you all. This is just something interesting. So ulcerative colitis and Crohn's disease, right? They're both chronic inflammation of the digestive tract, but you'll see here as far as with Crohn's disease, it can be throughout the digestive tract, right? So you can see here as far as the rectum, the anal canal. You'll see here as far as jejunum, ileum, right? Ascending colon, transverse colon, right? Crohn's disease, it can attack all throughout. They're just showing you these specific areas, but it can attack anywhere in the digestive tract, also Crohn's disease. Ulcerative colitis, primarily it's the distal portion of the digestive tract and in the colon itself, hence the term colitis, right? So colon. So you see here descending, sigmoid, right, colon, right? So you'll that you need to know as far as the differentiation between those two types of digestive system autoimmune diseases. So a hypersensitivity, right? If you're hypersensitive to something, so think of like something as common as hay fever, right? Or pollen in the air or dust, right? So people are allergic to dust, and really think about what dust is. Honestly, when you primarily throughout your house, primarily dust is your own skin cells, the skin cells of the people that live within you in your home. Okay. But it's hypersensitivity. When the body's immune system fails to protect itself against foreign material, it develops this allergic reaction, this hypersensitivity. And folks, we all know that. We have an idea that anaphylaxis or anaphylactic shock, this can be a life-threatening situation where the whole body goes into shock, and this can lead to death. So here we'll see here as far as swelling of the conjunctiva of the eyes, runny nose. One of the issues here, folks, that we think of is, look at where it says respiratory, shortness of breath, wheezing, stridor, so that the tubes become narrow, right? So it's a weird kind of a strange sound, but it's not a good sound. Hoarseness, pain with swallowing, coughing. So in other words, we're having issues where the respiratory system is closing up, and that can lead to death. Fast or slow heart rate, a low blood pressure, and if that low pressure keeps on dropping and dropping, that can lead to death. Lightheadedness, loss of consciousness, confusion, headache, anxiety, right? So, hey, hives, itchiness, flushing, these are all issues that can be a symptom of anaphylaxis or anaphylactic shock. Life-threatening. EpiPen, right? So adrenaline, right? Epinephrine, aka being distributed into the body, so it can allow for then dilation of these areas where we're having constriction taking place in the respiratory system, and also allowing for then more blood flow going to the brain, right? So important areas where we don't want to we want to increase the blood pressure in order for this patient not to have low blood pressure where they end up crashing out. Here's just another one, just giving you some more ideas and information there. Okay? As far as AIDS is concerned, right? So HIV can become full-blown AIDS, and this can lead to acquired immune deficiency syndrome. And so a patient who has full-blown AIDS can be susceptible to illnesses that you or I can, our body's immune system can fight off. But what's going on with theirs, right? So their immune system refers to the body's natural defenses against cancers, diseases, and infections. There's a deficiency, there's lacking of that cellular immunity, that the T lymphocytes doing their job, which is crucial to the immune response. And so they can end up dying from, like I said, different types of infections and cancers that would normally not really affect a healthy person. Now, I'm trying to think, this is maybe like about a 2-year-old PowerPoint. So understand that. So HIV/AIDS statistics: 50,000 people in the U.S. infected annually. So I don't know, and I have to look up the more current numbers. 2.1 million in the U.S. living with AIDS. Right now, I know that the treatment that's present, and really early treatment is good. So prior to becoming a full-blown AIDS situation where the patient has HIV present, they're able to work with medications and such that can really help to suppress the virus, which is really quite amazing. In all these years, they've been able to develop that. So we're talking almost like 40 years later. So I remember when the AIDS diagnosis had just come out. I actually have an uncle on my dad's side of the family who was incarcerated and ended up dying of AIDS. Yeah, so pretty crazy stuff. And I remember that back in the day. It's pretty scary stuff too. So, and it still is scary, folks, really, truly. You need to be very careful as far as whatever type of behavior you're doing, that you're protecting yourself for sure. Let's see here. So, and I mentioned to you earlier there, as far as the HIV destroys the body's CD4 cells, those helper T cells, and really opportunistic infections as a result of a weakened immune system can take place and can make the patient very sick and can lead to death. So sexual contact, sharing hypodermic needles, sadly here, right? So from an infected mom to the baby, at birth through breastfeeding, this can all transfer the AIDS virus, the HIV virus to them. Transfusion of contaminated blood. So patients who were hemophiliacs who had regular transfusions were in the beginning when the blood supply wasn't as protected, and people that had HIV were donating blood. There was issues with contamination in patients that were not doing any type of risky behavior other than just receiving treatment for hemophilia that were coming down with HIV, and people ended up dying as a result. Very, very sad. Different types of screenings present in order to test for, and even a rapid home test that's available. Here. And the symptoms here, as far as flu-like symptoms: blotchy red rash in the upper torso, lymphadenopathy, different types of opportunistic conditions where say certain types of Kaposi's sarcoma, which is a type of skin cancer that again too really is not an issue for people who have a healthy immune system, but those that are immunocompromised can die as a result from. No cure, but like I said, with HIV, there are many drugs out there now, and you would say different type of protocol that is performed that can really make a difference for patients and really help to suppress the virus, which is, like I said, amazing.